Now, in a major development in the saga between Professor Glenda Gray and the National Command Council, the South African Medical Research Council Board has now apologized to the Ministry of Health over Professor Gray's comments, and it's barred the scientists and staff members from speaking to the media. Now, around 250 doctors, scientists, academics and policy experts have all signed a statement of support for Professor Gray, defending the principle of academic free speech. Professor Gray spoke to Newsroom Africa just last week, and she says she doesn't believe the lockdown regulations are based on science. She says non-pharmaceutical interventions like social distancing, good hygiene and the wearing of protective face masks are crucial in containing the spread of the virus between people. Let's take a listen.
I think the lockdown was important and imperative to slow down the virus transmission and to get the country ready for the medical part of the epidemic. And so it's critical for that to have happened. The way we move out of the lockdown should be science-based and should be based on ways of preventing transmission rather than any other measures. My suggestions around the regulations is that they should be science-based and based on minimizing transmission, onward transmission of the respiratory virus. And that's my take on the regulations that were issued were that they weren't supporting the onward transmission of the COVID virus. And so I made examples such as what clothes you could buy, because there's no evidence that clothes can spread COVID-19. What we do know what spreads COVID-19 is transmission from person to person and from surfaces. And so what we do need to do is we need to implement non-pharmaceutical interventions, which are social distancing, wearing face masks, or covering your face, washing your hands or sanitizing your hands, and making sure that surfaces are clean. You also need to make sure that you minimize contact with people for too long. And so that is why it's imperative that if you are in a taxi, that you are wearing a mask and that you make sure that your hands are clean and you don't touch any surfaces. So my advice around easing the lockdown is to rapidly implement what we call non-pharmaceutical intervention.
All right, let's continue to unpack this story now. We're joined by a family physician and CEO of Proactive Health Solutions, Dr. Fundile Nyati. Dr. Nyati, thanks very much for your time this morning on the AM report. And I'm taking a look at your Facebook post on this issue. And in fact, you open up your statement around this saga on the fact that you've met Dr. Gray before. This is nothing personal, but there are some real inconsistencies with what she had to say, and in fact, complete untruths as well.
Well, I think I need to start with that comment again. I have great admiration and respect for Professor, Glenda Gray. She is the best, scientist, or one of the best scientists that this country has ever produced. The fact that she's got, Order of Mapungubwe, she's had also, she's been recognized also by Mandela for health and human rights. She's an A-rated scientist, so she represents the best of South Africa, and she's one of those people that we really need in this country to continue doing the good work she's been doing in the area of HIV and AIDS. So I just wanted to put that to rest, to say we need somebody like her. But my comment was then that, if you read the letter or the statement that was released by the Minister of Health, which was very, very detailed, there's about 5 issues that he is taking issue with an article that had been written, which was quoting a professor. Now, if you look at the responses by the minister, you then come to a conclusion that there are areas where I think the professor might have, made some error of judgment or some mistakes. I'm putting it mildly because the minister actually says these are complete untruths that were deliberate and all of that. But I choose to say, like all human beings, she made an error of judgment, and for that reason, and the fact that after that statement by the minister, there wasn't anything coming from her side to dispute anything that the minister has said. Instead, what you then see is the fact that there is 250 scientists who are now saying she is being tackled without a ball, basically. And I feel that it need not have gone to that level. After, the letter by the minister, as an individual, she should have taken stock and said, you know what, in the greater interest of the country, maybe I could have done better in terms of communicating whatever I was trying to communicate, and let the matter to end there and not escalate. However, the entry of the 250 scientists who are saying they are entering the debate because the acting Director General of Health has actually asked the South African Medical and Research Council to investigate and take action against, the professor. I think it need not have gone to that level. That's why I'm saying it should have been a situation where she takes stock, she apologizes unconditionally to the minister and to the National Command Council, and and then we move on with the big job of saving South Africans from all that we are facing, as we are still facing the peak of this pandemic. Yeah,
so you're also saying that this is not exactly just a cut and dried case of a threat to academic freedom of speech. And in fact, Becky Sisa has also written a very interesting article over the past couple of weeks around the fact that the politics of COVID-19 is not, surprisingly, it's not based solely on saving lives and finding a vaccine. Truth be told, and this will come as a surprise to people like me who don't work in the field, there are personalities here, there are different kinds of people, different scientists, and they all have different agendas. So it's not just as simple as that.
Well, I think that is an honest assessment. You can't assume that the whole body of scientists are, a body that is 100% united on every front, And again, I think in the South African context, something that I mentioned on my Facebook page, in the South African context, unfortunately, one has to also look at the external environment within which they are, doing their work. And we still have a situation where the issues of race in South Africa are still very, very important. We still have an issue where, issues of privilege are still very important, issues of inequality. But also within the very scientific community, if you look at the universities themselves, there are different levels of universities. There are those that one would say the previously advantaged, elite universities. I'm talking about medical schools here, and you'll put Wits there, you'll put UCT there, you'll put Stellenbosch there. And there are those like where I qualified, like University of Natal, Stefako Mahato and WSU. Those are maybe considered at the second tier. And if you look at the list of the 250, scientists that are in there, they are largely coming from what one would call the elite universities. And they are largely, mainly white, professionals. Now, one would say, why do you bring the issue of race into this whole thing? Unfortunately, it stands out. You don't see many. There's only two from my university. The head of infectious diseases and the head, of critical care. But generally, you don't even see the dean of the faculty of UKZN Medical School. So that tells you that there is some form of division. Those who are aligned to Natal University, which obviously is the one that has put forward, Professor Abdul Karim, are absent there. But also, if you look within Wits, Professor Velapi, who is quoted by the Minister of Health in his letter, Professor Stendiso Velapi, as the head of pediatrics at Baragwanath, he is missing there. So you then have a sense, and you go back to the letter from the minister. He brought in the issue of a question mark about why, Professor Gray was not made the chairperson, and the other professor was made a chairperson. So there are some undertones, of racism. There are some undertones, of some struggles within the scientific community. And they are now seemingly exposing themselves in this situation. The other issue is that there has been a lot of supercharged, climate in the political environment, especially with the Western Cape very much against what the national government has been doing in the area of managing this pandemic. So to come up then with a statement that is viewed by the minister as actually discrediting the work that they are doing in a climate where one is getting pressure from opposition parties like the DA, it then creates a situation where there's a lot of mistrust and there's super sensitivity by all those who believe that they are being attacked. Because if you look at the title of the statement, the minister actually views this as being personally attacked. The government is being attacked, and it is on that basis then he says that the body that employs Professor should actually take action, something that was followed up by the acting Director General.
All right, Dr. Nyati, unfortunately we've run out of time. Thanks so much for your time on the AM report. Such an important issue here as we continue to track the saga around Professor Glenda Gray and the National Command Council. Just a note here that the staff members and Professor Gray, they've all been advised, in fact they've been barred from speaking to the media, so we will not be getting a reply from Dr. Gray, Professor Gray, to what Dr. Nyati has just said. But Nyati is CEO of Proactive Health Solutions. He's also a family physician. Politics never far away, even in the midst of a pandemic.